Ayan, sorry. To bring out emotionally critical misperceptions, yung mga ECMs ng mga pasyente out in the open so that the doctor can correct them more easily. Yan, active listening skills are extension of generic communication skills, which involves verbal and nonverbal communications, just as I said a while ago. So they are characterized more by what is not done than what is done. Because real active listening requires the listener to avoid common responses when listening, even internally, you know. Ayan, even internally. And these habits are very difficult habits to break. No, these are called roadblocks or yung mga distractions. So let us discuss some of the roadblocks in active listening. No, these are judging, suggesting solutions, and avoiding other concerns. Under this main roadblocks are yung mga ano nila. Yan. Let us try to discuss kahit konti sila. Yan. One roadblock is judging. No, this is the natural tendency to evaluate from the listener's own frame of reference and to approve or disapprove of what another person is saying. Ito yung mga judgmental ba? Meron ka na kaagad na iisip na bawa dumating yung patient, ang suot niya ay medyo skinny jeans, spaghetti strap. So pagpasok pa lang ng patient, meron ka nang naiisip kung ano ba yung trabaho ng patient, kung ano ba yung mga pwede niya ikonsulta, no? So that is being judgmental, no? This is one of the major barrier to interpersonal communication kasi wala pa mang sinasabi yung patient, na-judge mo na siya, no? Meron ka ng inisip sa kanya. Another roadblock is labeling, no? Tayong mga doctors, medyo ano tayo talaga dito kasi sometimes we label our patients as diabetic, epileptic, mga asthmatic, mga gano'n, yung mga ik-ik natin, no? According to Carl Rogers, to label someone by one characteristic only, like being diabetic, ganon. Kahit na gaano ba ka-accurate yun, kasi diabetic naman talaga yung person, no? Is to deny all their experiences, talents, weaknesses, and traits. Parang it reduces them to their diseases and denies them their individuality. So parang pag nilabel mo sila, parang yun na lang sila. Wala na silang ibang personality. Parang ganun. So it makes it appear that we know the other person when actually we only caught the shadow and not the substance of the person. So sa area na to, usually ang ina-advise is not to label the patient as diabetic. We can address our patient as a person with diabetes, no, a person with epilepsy or a person with asthma, ganon. Or sometimes in dun sa mga past geria lectures na inattendan ko, yung mga geriatric patients natin, ayaw na nilang nagpapatawag na elderly, no? Ang gusto nila sometimes ngayon is to address them as a person, older person, mga ganon. Ganon na yung gusto nila ngayon. Okay? Ay kapag may question kayo, you may butt in anytime ha, or clarifications. At ayaw na mag-move. Yan. Another roadblock or distraction is suggesting solution, no? Which is an area problematic for medical practitioners, no? It includes ordering, no, threatening, moralizing, or excessive or inappropriate questioning or advising, no? As medical professionals, as doctors, usually uh, our patients seek solutions, answers, cures, and guidance, no? Kaya usually, No, nahihirapan tayo dito kasi tada tayo ng tada kasi gusto natin ma-educate natin yung patient. But um, this is a risk, no? It takes because it takes responsibility away from the person and disempower them by saying, parang sinasabi mo, indirectly saying, you can solve the problem or but I am better or smarter than you, so I have to do this for you. Parang ganun. Kung palagi ka nagsasuggest na solution, no? And another roadblock is avoiding other concerns. So this is to deny the person the opportunity to talk about their problems or worse still, try to convince them that they are not serious problems and they are foolish to be worried about them. No, pag halimbawa, may concern yung patient na nagko-consult sa'yo, no? Tapos sinabi mo na, "Wala yan, 'di naman yan problem, okey lang yan, 'wag kang masyadong mag-worry." Parang gano'n. Ah, Hindi masyadong maganda yun, okey? So, ayan, bago tayo pumunta dun, ayan. So, if a patient, comes to you and you are able to listen and be empathic, no? The patient will surely feels understood, and rapport is quickly built, no? When the rapport is built, the patient is more willing to reveal themselves to you, no? Allowing you to see where the anxiety of the patient is coming from, no? So once the misperception is recognized, no, you can answer them or address them properly. So these are some of the active listening skills that we need to master. No, these are attending skills, bracketing, leading, reflecting, probing. Okay? So let's discuss muna yung number one, which is attending. So it refers to the way in which we use our bodies, no, to communicate the message non-verbally that I am listening to you, no? May mga nakikita akong meme ngayon, di ako masyadong techie, no? Pero may mga nakikita akong meme ngayon, yung tell me, yun yung picture lang siya, parang i-communicate mo sa akin without saying anything, parang gano'n. Di ba uso yung mga memes na yun ngayon? No? So parang ganun yung attending skills. So these are some gestures that communicate the message of openness and understanding. Number one is leaning towards the patient as he speaks. So try natin, no, habang nagsasalita ako. So leaning towards the patient as he speaks, no. Medyo lalapit ka lang ng konti, 'wag sobra-sobra, no. I-mind pa rin natin yung personal space ng patient natin. Or tilting or nodding the head. So try natin, nod ng head, no? Raising the eyebrows when the patient makes an important point. Pero 'wag naman sobrang raise the eyebrows na lumalaki din yung mata. Baka akala ng patient pinagmamalakihan niyo siya ng mata. And maintaining eye contact. Yan. Let's watch a short video about attending skills. Yan. Nakikita yung video?
Yes, I
Hello?
am.
Kita? Ayan. So notice how Ronald is facing Chris. Yan. So hindi siya masyadong malapit, hindi rin siya masyadong malayo. So, ito yung mga hindi dapat gawin. Yan. Okay? Magkaharap kayo, pero wag masyadong close sa patient. Okay? Kasi nava-violate natin yung kanilang personal space. Okay? Sabi, you should feel their feelings but not their legs. Siya na lang yun. And Ronald nods his head and while the speaker continues to speak. So kahit maliit ang mata, and may eye contact. So ito wala siyang eye contact. So mukha ba siyang nakikinig kung hindi niya masyadong tinitingnan yung patient? Tapos mukhang nag-assume na siya. So ito yung ibang roadblocks na pinag-usapan natin kanina. Tapos parang mukhang nagbigay siya ng opinion niya, no? Kaya no, parang nagmamadali. Kaya nodding is a sign na nakikinig ka. So ayan, mukha ba siyang nakikinig? Mukha siyang naantok na kasi nabo-bore siya dun sa sinasabi ng patient. So remember, good counselors care about what the patient is saying. Okay? Ay, wait lang. Ayan. So in short, yung attending skills ay may acronym, no? May mnemonic siya na lovers, no? Uh, L stands for lean forward. O for open stance. So usually minsan tayo kapag hindi natin napapansin yung stance natin are important to the patient, no? Like kapag kausap mo yung patient, wag natin i-close yung stance natin, like yung hands natin or arms, wag natin isasara sa harapan ng katawan natin, okay? Maintain an open stance kasi it tells your patient that, okay, you may open up to me. Ano ba yung problem? Parang ganun. Okay? V stands for voice of compassion. Siyempre naman, kailangan para mag-open yung pasyente sa'yo, kung ano yung mga nararamdaman niya talaga, kailangan yung tono natin ay controlled, no? Kailangan yung boses natin parang hindi mapoprovoke yung pasyente natin, no? And E for eye contact, no? You should maintain eye contact with the patient para na alam niya na nakikinig talaga tayo. R for right attitude and S for sit at an angle. No? So tandaan natin to, minsan kasi lumalabas yan sa mga exams, no? Sa mga in-service exams. Okay, after attending skill is bracketing, no? Bracketing means setting aside your feelings, thoughts, and judgment temporarily, no? So that there will be a space in our minds and in our hearts for what the patient is really saying, no? Sometimes our view of the problem is colored by our biases and prejudices, our preconceived notions about the patients or about the situation he is describing. Why? Because we are as a person, no, meron tayong mga kanya-kanyang upbringing, we are entitled of our own thoughts, no. In active listening, no, bracketing skill, no, we have to set aside our preconceived thoughts and judgments, no? Para dun sa patient natin. So next is leading skill. Yung leading skill, meron siyang dalawang component na indirect lead and the direct lead. Ang indirect lead is an it's an open invitation made by the doctor to talk about any topic the patient wants. No? Examples of questions that you can ask them is, what would you like to talk about? Okay? Para open na open siya. Or, what can I do for you? No? Parang inviting the patient to say something. Or sometimes, hindi man sila sentence, words lang sila like, yes, go on, and then, parang ganon. Or kahit hindi man siya sentence, hindi siya word, minsan, mga utterances lang siya like, aha, mm-hmm, oh, mga ganun lang, no? While direct leads naman requires that the doctor make a judgment call so as to where the patient should go and ask him to go in that direction. Okay, may mga patients kasi na kapag very emotional sila upon consult, no, parang nagbi-mix-mix na yung mga sinasabi nila, no. So example, no, pag ang patient sinabi niya is parang ganito, when my chest hurts, I begin to think that I am having a heart attack and then I become afraid of what might happen to my children if I die. So, example of a direct lead is pwede mong itanong na what are you afraid might happen to your children, no? Ano yung kinakatakot natin na pwedeng mangyari sa mga anak natin kapag nangyari yon, no? So note that the doctor did not introduce a new material or a new topic, no, other than what the patient already has brought up. No, yun yung leading skill. Next is reflecting. So yung reflecting, pwede kang mag-reflect ng content, feeling, experience, no? So let's discuss a case para ma-differentiate natin yung tatlo. So ito yung scenario, may 45-year-old male walks in the office, sits down, then stands up, and looks out the door to where his wife is sitting. Then, he shuts the door and sits down again. No, ito yung patient natin. Ganyan yung unang scenario. So, ang sabi ng patient, Doctor, a month ago, I had this sore throat. So, when I went to a doctor and he gave me a penicillin for it. So, I took it for 7 days and it went away. But a week later, I had the sore throat again. So, the patient shifts in his seat and looks at the floor. The doctor gave me amoxicillin this time and I took it and the sore throat went away. But a few days ago, and then, ito na yung scenario ng ginagawa ng patient. Patient takes his handkerchief and crumples it and pulls it at it repeatedly. And then, but a few days ago, the sore throat came back. And then his voice becomes softer and the patient shakes his head. So kapag reflecting content, the doctor repackages and rephrases what the patient said so that it becomes clear and give it back to the patient. Okay? So may dalawang way ng pag-reflect ng content kasi i-repackage mo lahat yung sinabi niya in a few sentence, no? Number 1 is paraphrasing. Number 2 is perception checking. Now, yung paraphrasing is the doctor uses fewer pero clearer words that summarizes to the patient what the patient has just said, no? Usually kapag yung patient emotional na, 'di ba? Minsan mix tapos ang dami-dami na niyang sinasabi. So in paraphrasing, kukuha ka lang dun sa mga sinabi niya ng mga importanteng thought dun sa sinabi niya tapos pagsasama-samahin mo siya in a clearer sentence. Okay, parang summary siya nung lahat ng sinabi ng patient. While perception checking naman, it is used when the doctor is not certain, no? Kapag may gusto siyang i-confirm, no? If the doctor is not certain if he understood the patient correctly. So example, ito yung pwede mong itanong, pwedeng maging tanong sa paraphrasing, no? So this is the third time you had sore throat within a month and you can't understand why it keeps coming back. Yun yung paraphrasing, no? While perception checking, no, gusto mong i-check, i-confirm kung tama ba yung nakuha mo dun sa sinabi niya, no? This is the third time you had sore throat within a month and you can't understand why it keeps coming back. Is that it? O yan, parang nagko-confirm ka. So yung sentence na "is that it" provides a tentative flavor to the intervention and invites the patient to correct the doctor's perception if it is wrong. Or um, mas na-open ka, mas ino-open mo yung patient to discuss more on dun sa sinabi niya. Next is reflecting feeling, no? The doctor articulates the feeling for the patient, no? Parang ikaw na yung nagsasabi sa patient kung ano yung nakikita mong nararamdaman niya, no? Pwede siyang i-phrase sa ganito. You seem to be quite anxious about your sore throat, no? Because sometimes patient are not aware kung ano yung nagiging feelings nila. So may therapeutic purpose ito. So by giving a name to the feeling, the patient becomes more aware of the emotion. Thereby, consciously examines and the perception behind the feelings can also be uncovered. So being able to express the feeling, which are usually hidden, allows emotional catharsis and provides relief. And when feelings are accurately reflected back, the patient feels understood and the rapport between the doctor increases and the patient feels encouraged to tell the doctor more. Okay? Sometimes kasi hindi sila aware kung ano yung nararamdaman nila. So parang um, in-address mo yun para sa kanila. Next is reflecting experience. So in the case presented, the patient has several gestures, 'di ba? Yung scenario, kung ano yung mga ginagawa niya, no? Which indicates some underlying feeling or perception. So pwede mong itanong ito sa patient. I noticed a while ago you look at the door at your wife, then you shut it. Could you tell me what was behind that action? So the value of reflecting back these nonverbals is that these are often done unconsciously, no, and the patients are not aware. So once aware, no, once na parang na-address mo yun at ni-notify mo yung patient kung ano yung napansin mong ginagawa niya unconsciously, he can now consciously process the behavior and by doing so gain insights as to the feeling or the perception behind. And the last skill for active listening is probing. Ano ba yung probing? These are questions, no? Parang nag-investigate, no? These are questions that are asked in order to elicit more information. By adding probes for emotions and inviting the patient to talk more about them, it is possible that to provide catharsis for the patient and vital information about what perception or misperceptions that are causing the emotions so that they can be addressed better when you finally give the education and your advice. So, pwede mong itanong sa probing, no? How does that make you feel? Or can you tell me more of the feeling? Or can you tell me more about that feeling? What is it that makes you feel that way the most? So this is a video I've seen in YouTube, no, which parang sinasummarize na yung active listening skill. This is a very nice video. Pakinggan natin, no. Tapos you may comment kung ano yung mga sinasabi niya dun sa na na-discuss natin, no. Wait lang.
Important because good listening is probably
Dok, wala pong sound, Dok.
Ay, wala siya sound. Sorry, sorry. Yan, meron na sound? Meron na ba siyang sound?
Wala pa rin
Wala
po
pa
sa
rin
Wala
po.
pa
akin.
rin. Wala pa rin, Dok.
Nung una po meron, pero naputol.
Wait ah. Yan, meron na.
Wala pa rin po.
Yan pa din.
Ayan po, meron na, pero choppy.
Parang yung sa una lang, Dok. After po nun, mawawala na yung sound, Dok.
Wala. Sayang naman, maganda yung video. Wala pa din. Wait lang. Wala pa din.
Wala pa po, Dok.
Kaya ko na. I-share ko na lang mamaya yung link sa video na to. Pero maganda kasi siya. Parang siya yung summary nung lahat ng diniscuss natin. Hindi ko alam kung paano ko siya iaano. Pero ito na lang. Sana naman mag-play na to. This is a clip from Big Bang Theory about Big Bang Theory, no? Nakakatawa siya. Sana pwede na siya. Tapos react tayo after nung video. Meron siya sound?
Wala po, Dok.
Ano kaya to? Wait lang. Yan ba? Naririnig nyo? Di rin.
Wala siyang sound, Dok.
Ay, kainis. Hindi ko alam ayusin. Okay, sayang yun. Sobrang nakakatawa to. Wait, try ko mag-stop ng share tapos i-reshare ko ulit. Ay, yung video. Ano bang problema? Sana meron na. Wala pa din. Wala pa ring sound.
Wala pa rin Pudra.
Ayoko na.
Try kong share yung yung clip.
Ano?
Try kong share yung clip sa baka sakali may audio.
Ano gagawin natin?
Inopen ko yung YouTube clip ng Big Bang.
Sige.
Try kong share.
Mag-stop share ako, tama ba? Yun ba yung sinasabi mo? Ayan. Yan, meron na ba?
Wala pa rin po, Doc.
I-share ko na lang yung link tapos panoorin nyo na lang. Wait. Nakakatawa kasi siya kapag may sound siya. Ano nangyari? Okay. But, yun na yung last nung slide ko. Yan, kasi dapat mag-a-analyze tayo ng video. Kaso, hindi ko naman ma-share. Paano na yun? So, yung mga the lecture came from Dr. Alan Jonicio, Active Listening Skills, and Dr. Catherine Robertson, Active Listening More Than Just Paying Attention. Galing sa kanila yung ni-lecture natin for tonight. So, that's the end of the lecture. I will just share the link sa Viber group natin para mapanood nyo. Kasi very nice yung mga videos. Para din maalala ninyo kung ano yung mga skills. Okay? Meron po ba tayong questions? Mabilis lang to kasi. Pero, usually kasi palaging tinatanong sa in-service exam. Actually, na-lecture ko na ito before sa mga mas senior. So, dapat sila na lang yung nagle-lecture, no? Kasi alam na nila to. Any questions po? Or addition, subtraction? Meron po ba? Narinig niyo ako? Ayan. Meron po bang questions?
Wala po.
O magsisend ako ng quiz kay Doc Tay, no? Siya na bahalang magbibigay ng quiz sa inyo. Dapat ang MPL is 75%. Kasi walang question. Okay. Doc Tay?
Good evening. Hello?
Hello po. Good evening, Dr. Abby.
Oo, Doc Ivy, inquire ko lang, may copy na sila nung kay Doc Junicio?
Nag-send ako sa kanila nung post
Yung
after
book
nung
mismo?
yung book mismo, Doc
Mm.
Kai.
Wala pa yata.
Ah. Siguro highly encouraged talaga siya kasi high yield yung kay Dr. Junicio, lalo na sa mga exams. Tsaka yung para mas ma-absorb mo, maganda yung book na yon. So, siguro I think si Doc Tay may kopya.
Yeah.
Kung yung mga residents, magagamit niyo siya kahit sa sa diplomate exam, annual in service, mga ganyan. And ayun, so mas
Totoo
maganda
yan.
kung saan siya. Tapos hindi siya very tedious, sobrang siya, user friendly. Hindi, parang hindi siya boring kasi ang lalaki ng font, so hindi naman kayo mabobore sa pagbabasa niya. Yun lang.
Abi, binalik ko na ba yung kopya mo?
Parang hindi pa yata siya.
Oh my goodness. Sige. Binalik ko.
Hindi ko sure. Tingnan ko din ulit, sir, kung nabalik na ba sa akin. Nabalik na ba? Parang hindi ko po sure. Parang hindi ko pa naaalala. Tingnan ko rin, sir. Thank you
Sige.
po.
Thank you. So anyway, thank you, Ivy.